talk about the disease from about diabetes from different perspective. We'll try in the coming few 15 to 20 minutes to talk about diabetes burden from an economic point of view. So starting just to touch on a few slides about prevalence, I'm sure it was covered by many in the previous lectures, but because it's very relevant to the economic burden. As you all know, and according to International Diabetes Federation, around 463 million people are living with diabetes worldwide, and reports estimate that in the coming 20 to 30 years, this number will rise to around 700 million. 80% of those patients diagnosed with diabetes are from low and middle income countries, which create, of course, a challenge, a public health challenge to these countries. Looking at the data locally, as you all know, Saudi Arabia has the highest diabetes prevalence in the region, and we have around 4.3 million people suffering from diabetes with a prevalence of 18.3%, and the growth here in the kingdom, not only in the kingdom but also in the region, is driven by the increase in sedentary and unhealthy lifestyles, urbanization, and also aging population. So 1 in 6 adults in our country will have diabetes, which means, as I said, 4.3 million people. 40% of them are undiagnosed, around 1.7 million people, and those will constitute to a lot of cost because they will get, because they're uncontrolled, they will get complications that are really expensive. We have around 15,000, more than 15,000 deaths per year related to diabetes, which means, unfortunately, 41 deaths daily. So let's look at figures and data around the spending on diabetes. Diabetes in total is costing the world around 760 billion US dollar, and this report was done in 2019, and this constitutes around 10% on the total healthcare spending on adults. One good quality study that I found estimated that the average cost of healthcare for a person with diabetes in the US is around 16,752 US dollar a year, and this is done by the American Diabetes Association. We will look at the cost breakdown of this number in the last slides to show where we are spending, what categories this will fall on. So as you all know, GCC countries have higher diabetes prevalence and expenditure compared to not only the world, but also MENA countries. As you can see, the cost in the cost is highest in Qatar, where they spend around 6,566 riyal per patient per year. The lowest cost spent is on Oman, where they spend around 2,800 Saudi riyal per year on adults with diabetes. The remaining countries, including Saudi Arabia, have a range between 4,000 and 4,600 Saudi riyal per patient per year. So the total, looking at Saudi in particular, the total healthcare spending is around 130 billion Saudi riyal. So as you can see, healthcare is expensive. Unfortunately, 11.5% of this amount of money is going to diabetes care, which is around 15 billion Saudi riyal, which means that we are spending 11.5% of our budget on only one drug and its related complications and comorbidities, namely diabetes. 4.5% of this figure, which is around 680 million Saudi riyal, goes to prescriptions, to medications, and this represents 0.5% of the total healthcare spending in Saudi. And believe me, this is an economic figures is really significant, and I'm sure it's above what is spent in other countries. Spending on insulin alone represents around 1.2% of the total spending on diabetes. So you can see here that diabetes management is really expensive. And if we want to assess the cost of diabetes, we need to look at different costs included in economic burden of this disease. And the assessment of the cost of diabetes is very important to provide recommendations for policy and decision making. Usually in economic evaluations, we have two different types of costs, direct or indirect. Direct costs are the costs that includes medical costs of diagnosis, treatment, lab testing, hospitalization, staff fees, equipment, supplies, and they also include the extent to cost associated with treatment, such as cost of transportation, travel, and home care. Indirect costs usually focus on human capital losses, including the value of lost productivity, such as absenteeism and presenteeism. And there is difference between these two terms in economics. Absenteeism is the missed working days due to the illness. So it means that you're not going to work because you have diabetes. Presenteeism means reduced productivity while at work. It means that you are at work, but you're not producing as usual because you're ill. In addition to this, it includes unemployment and the impact on productivity of family and caregivers. So why diabetes is expensive? What drives this high cost in diabetes mellitus? First, we have the high prevalence of diabetes in the region. That's why I put the slides on prevalence the first, because this is very important. That's why we have high costs, diabetes costs in our region. There is also another factor, which is high prevalence in children and elderly, and I will show figures about this in particular in children. Also high prevalence of comorbidities, which increase the cost of the disease, prevalence of macro and microvascular complications that are very expensive to manage, and the hypoglycemic control. It is very important to make sure that we are controlling the blood sugar of our patients, because every 1% increase in HbA1c can increase the risk of long-term diabetes complications. And if you can see, many of the previous lectures talked about the glycemic control. So talking about the prevalence in children, you can see here that Kuwait, Saudi, and Qatar are among the top 10 countries with the highest rates of children in the world, based on reports from International Diabetes Federation in 2019. And this means that the lifelong cost of the patients with diabetes will be very high, because you're starting treatment from age 4 or 5 until the death of the patients. So the cost will be extremely high compared to patients with type 2 who are diagnosed, for example, at age 40 or 50. Also in this slide, we see the high prevalence of risk factors such as obesity and cardiovascular risk factors, which represent a real public health challenge for Saudi Arabia. We have a very high prevalence of obesity. I believe there are unpublished reports by Saudi Health Council that shows that the prevalence of obesity is even higher than the number on this slide. It reach above 60%. Unfortunately, the prevalence of abdominal obesity is around 65.5%. Prevalence of hypertension is 31.4%. Prevalence of dyslipidemia is more than 55%, and all of these risk factors drives the increase in burden and cost of diabetes. So as you all know, diabetes is a progressive and burdensome disease. It is associated with very serious macro and microvascular complications. Around 72% of our patients who have diabetes suffer also from at least one chronic complication. Diabetes have higher cardiovascular related mortality risk compared to healthy population, higher risk of blindness, end-stage renal disease, amputations, which means that the hospitalization rates are longer and more frequent in diabetic patient, which pose a crucial problem from both clinic and public health perspective, which also highlight the importance of appropriate management of blood glucose in this group of patients. This slide shows that an example of patients who have higher prevalence of chronic complications. As you know, around 30% of our patients can develop chronic kidney disease. They will require either dialysis or kidney transplants, which are extremely expensive medical procedure. And this money spent on those patients to save their lives, we can use this money to prevent these complications early upon diagnosis and spend this money more wisely on other categories of patients. What I'm trying to say is that this is preventable, unfortunately. We do have another costs. For example, I'm trying to show you the cost of diabetes on absenteeism and productivity loss. Unfortunately, I couldn't find anything local. However, I used the same study from the American Cardiac Association, where they show that the average cost of healthcare for one patient with diabetes is around 16,752 US dollar a year. And I wanted to show you the breakdown of this amount of money. Only 9,600 is attributed to diabetes direct care, and this is around 2.3 times higher the expenditure on other categories of patients who do not have diabetes. So the US system is spending 2.3 times the money spent on any patient on patients with diabetes. And this is in terms of direct costs only, including lab testing, medication, treating complications and comorbidities. So where does the other amount of money comes from, which is around 7,500 US dollar? They're either absenteeism and presenteeism, which means the cost of productivity loss. So I found other data that are related to absenteeism, presenteeism. Again, unfortunately, they're from the US. They found that the absenteeism and the presenteeism of diabetic patients accounts for 26.9 billion in the US healthcare system. Again, this means that either you are not at work because you're sick, or you are sick and still going to work, but you're not functioning well. There is also reduced productivity for those who are not in labor force, which means that productivity for example, non-working moms who will have to hire someone else to take care of their kids, or taking them to nurseries, for example, because they're sick and they cannot take care of their kids. There is also the cost of unemployment, which is around 37.5 billion US dollar, and this is the cost for those who cannot work or who lost their jobs because of the disease. There is also the loss of productivity to the whole society and the system due to premature deaths, which is 20 billion US dollar. So looking at the economics of this, every person is have economic value to the system, and if you lose this person, it's not only bad to the family, but it's also bad to the economy. This study showed that almost 30% at least of the cost of diabetes care in any system is attributed to reduced productivity. So we need to look at different interventions that can be considered cost saving and can be feasible in our region to reduce the economic impact of diabetes. And I believe most of these were also discussed by Dr. Mahfouz in the previous slide. So first of all, the most effective is the early detection and treatment and prevention. It's better to prevent the disease, and even if you will spend a lot of money on the prevention, it's definitely cost effective. It's definitely a good investment to spend on screening and prevention. As Dr. Mahfoud said, we need good control of blood glucose, good control on blood pressure and lipid control, good food care, and trying to screen and observe patients for complications such as retinopathy, early signs of diabetes related kidney disease, which means that we will detect these complications early and treat them early, which is good for our patients and also for our budgets and systems. So in summary, a take-home message is that diabetes is a large and growing public health challenge. It is associated with, as I showed you, significant healthcare costs. Without intervention, we will continue to take a significant health and economic toll on people in our region and the broader economy. We need public health actions and policies to promote healthier lifestyles that can have positive impact on our population, which are considered to be excellent investment for our societies. This is the last slide. Thank you for listening and attendance. Thank you very much.